Hello everyone. Diabetes onset is a complex interplay of various triggers that culminate in disruptions to the body's glucose regulation mechanisms. Understanding these triggers sheds light on multifaceted nature of diabetes development. Type 1 diabetes, often diagnosed in childhood or adolescence, results from an autoimmune response where the body's immune system mistakenly attacks and destroys insulin producing beta cells in the pancreas. Genetic predisposition significantly influences this process, with certain genetic markers increasing susceptibility. However, environmental triggers, particularly viral infections like Coxsackie virus and enterovirus, can incite the autoimmune response. Once the beta cells are compromised, insufficient insulin production occurs, leading to elevated blood sugar levels and the need for lifelong insulin administration. Type 2 diabetes arises predominantly due to insulin resistance. Genetics play a substantial role with various genes influencing insulin sensitivity and glucose metabolism. However, lifestyle factors significantly contribute to the development of insulin resistance. Obesity, especially abdominal adiposity, is a major trigger. Fat cells, particularly in the abdominal region, produce hormones and chemicals that interface with insulin's effectiveness, leading to elevated blood sugar levels. Sedentary lifestyle coupled with poor dietary choices high in refined sugars and unhealthy fats exacerbate insulin resistance. Advancing age also increases the risk of type 2 diabetes. Genetics are intertwined with environmental factors in diabetes development. Family history significantly elevates the risk of diabetes, but environmental influences modulate this predisposition. Factors such as prenatal environment, maternal nutrition during pregnancy, and early childhood diet can influence an individual's susceptibility to developing diabetes later in life. Dietary habits play a pivotal role in diabetes risk. Diets high in processed foods, sugars, and low in fiber escalate the risk of type 2 diabetes. Conversely, diets rich in whole grains, fruits, vegetables, lean proteins, and healthy fats can mitigate this risk. Consumption of sugary beverages and foods laden with refined carbohydrates directly impacts insulin sensitivity and blood sugar regulation. Physical activity is a crucial factor in diabetes prevention. Regular exercise enhances insulin sensitivity, aiding in glucose regulation. Sedentary lifestyle prevalent in modern society exacerbate insulin resistance and sustainability contribute to type 2 diabetes development. Stress management and sufficient sleep also influence metabolic health. Environmental factors and chemical exposure contribute to diabetes risk. Certain pollutants such as pesticides, industrial chemicals, and endocrine disruptors may increase insulin resistance and disrupt hormone function, elevating the risk of diabetes. Additionally, socioeconomic factors like income, education, and access to healthcare impact diabetes prevalence and management. Limited resources or disparities in healthcare access can impede proper diabetes care and prevention.